Hi, my name is Sarah Hancock, and I am the stroke coordinator here at Covenant Medical Center. Covenant Medical Center is actually a primary stroke center, and I work with stroke patients every day. So I just wanted to share a couple things with you so you can learn about stroke symptoms and what to do if you start having them. So there's a really easy way to remember stroke signs and symptoms, and it's called Be Fast. So the B stands for balance, so any kind of loss of balance. So you get up and all of a sudden you feel like you're staggering all over the place. The E stands for eyes, so any kind of sudden visual changes. So maybe you're having blurriness on one side, any kind of double vision, any kind of visual loss. The F stands for facial drooping. So whenever you smile, you're drooping on one side. I would do it for you right now, but I'm not really good at showing facial drooping. So the A stands for arms. So if you hold both of your arms out like this, and one of them drifts down, that means you have weakness on one side. The S stands for speech, so any kind of slurred speech, or the words aren't coming out like you're used to them coming out, or you're having trouble understanding other people. And then the T stands for time. Time is really, really important in strokes. So anytime you notice any of these symptoms in you or a loved one, you want to call EMS and get to the hospital as soon as possible. So EMS is really important because EMS actually calls us ahead of time, lets the emergency department know that you're coming, and then we have our entire stroke team meet you at the door in the ER. That's part of what makes us a stroke center, is that we have neurologists meet you in the emergency department so you can go directly to our CT scanner so you can get imaging so we can treat you as soon as possible. Now, I've mentioned time a couple of times. It's really important that you know what time your symptoms start because that depends on what kind of treatments we can give you. There are treatments for stroke. We have a really powerful clot buster that we can give. We also have a treatment where we can go in and actually pull the clot out of your vessel, but it all depends on time. So it's really important to get to the hospital as soon as possible and let them know what time your symptoms started. We'll be asking you that over and over and over again. Are you sure your symptoms started at 3 o'clock? That's when you first started noticing the symptoms. So now our treatments, not everybody qualifies for all of our stroke treatments. There might be some reasons you might not be able to get them, but it's really, a lot of it is dependent on the time your symptoms started, which is why it's important to get to the hospital so soon. The really powerful clot buster, we can only give it within 4.5 hours of your symptoms starting. And then the procedure where we go in and we pull the clot out of your vessel, we have to do it within 24 hours of your symptoms starting, but sooner is always better. We have a saying in stroke, it's time is brain, which means that we need to get you in as soon as possible to save those brain cells. So it's really easy. All you need to remember is be fast, balance, eyes, facial drooping, arm weakness, slurred speech. It's time to call 911. So you need to get to the hospital as soon as possible.